Telepharmacy.
Telepharmacy is pharmaceutical care and delivery of pharmaceutical from pharmacists through remote of communication technology to patients in different locations. Patients will be receive medication and pharmaceutical care within a place that are safe and easy to access with the care covering from patient counseling, treatment monitoring and side effects, and prescribing medication. Type or pattern. In patients, remote order entry review is the examination of the medication order from the doctor on the inpatient ward by a pharmacist in another location who can receive command to use and check prescription of medication. The benefit of the remote pharmacy is that it can be an alternative to hospitals that do not have a pharmacist on duty 24 hours a day. Remote dispensing. Remote dispensing is an process of the arranging and dispensing medication remotely from a pharmacist on duty and outpatient pharmacy or pharmacy to the patient with an agent or third party delivering the medication under the supervision of transport standard approval and review of prescription drugs. This by pharmacists before every delivery of the medicine. Benefit of the long-distance pharmaceutical it can help patients access more pharmaceutical care and essential medicines, facilitate in areas where there are no pharmacists or have geographical restrictions on access to medicine. It is evident that many international startups such as PillPack, Capsule, Remote Concealing. Remote concealing is an concealing a long-distance drug follow-up using communication technology such as live video call, text message from pharmacists in hospital or drugstore to the patient who is another place to provide patient with the advice, precaution, and practice in the use of appropriate medication. The benefit is the long-distance pharmaceutical is the expand of pharmaceutical care. From original, the patient care begins when the patient enters the pharmacy or operating facility and ends when the patient takes the drug. But monitoring side effects after medication or provide advice via telecommuting technology can enable patients to receive pharmaceutical care around the time medication is available and can increase accessibility to pharmaceutical care. IV admixture verification. IV admixture verification is the examination of sterile drug combination by a pharmacist in another location. It will review the prescription of medication from the doctor and check the mixing procedure of the staff or pharmacist assistant in the sterile drug mixing room through the video format, image, barcode. The benefit of long-distance pharmacy is that it can be expand the work of sterile drug mixing. Pharmaceutical can go out to various hospitals that are far away and also reduce risk of pharmacists from the original exposure to dangerous drug working time to monitor the mixing process. Example include sterile drug combination such as a chemotherapy for the cancer patient, intravenous nutrition, and ready-to-use antibiotics.
Standard of service. 1. The provider must be a pharmacist. 2. Provide a patient registration system, patient profile and medical records. 3. Provide a system for recording audio or video data while providing service and monitoring patients' medication outcomes that can maintain the confidentiality of patient information, and the pharmaceutical practitioner must obtain the patient's consent to access the patient information. 4. Establish a pharmaceutical care system as follows. 4.1. Interviewing patient and patient relatives to accumulate information necessary to provide pharmaceutical care such as patient's history of illness. 4.2 Prescription analysis and drug-related problems searching. 4.3 Advising patients or their relatives about medicines. 4.4 Referral patients to hospitals. 5. There must be a standard in transportation that can maintain the quality and stability of the drug throughout the transportation by taking into account 5.1 Temperature during the transport and type of drug. 5.2 Deliver complete and accurate drug for patient at determined place and in the determined time. 5.3 Prevent losing drugs and not being used in crime.
Working process 1. In the case of a hospital. 1.1 Receive prescription and check patient registration. 1.2 Consider providing appropriate telepharmacy care for patients according to the above standards. 1.3 Contact a long-distance pharmacy service recipient and schedule drug delivery. 1.4 Provide telepharmacy service recipient show that you have the same name as the patient registration and the name on the prescription. 1.5 Prepare a patient profile and medical records, which must be recorded at least throughout the service period. 1.6 Follow up on drug use of telepharmacy service recipients. 2. In the case of a pharmacy that receives a prescription. 2.1 Create a patient registration and prepare a patient profile that maintains the confidentiality of the patient, and allow patients to allow pharmacists to access their health information for the purpose of providing services. 2.2 Receive prescriptions and check the patient's registration with the hospital. 2.3 Consider providing appropriate remote pharmaceutical care for patients in accordance with the above standards. 2.4 Contact a telepharmacy service recipient and schedule drug delivery. 2.5 Provide telepharmacy service recipients show that you have the same name as the patient registration and the name on the prescription. 2.6 Patient profile and medical records must be recorded throughout the service period at least. 2.7 Follow up on drug use result of service recipients. 3. In the case of drugstores, serving without a prescription. 3.1 Register the patient and prepare a patient profile that maintains the confidentiality of the patient, and allow patients to allow pharmacists to access their health information for the purpose of providing services. 3.2 Taking sick history and provide services in accordance with good pharmacy practice. 3.3 Contacting telepharmacy service recipients and schedule drug delivery. 3.4 Provide service recipients show that they have the same name as the service recipient registration. 3.5 Provide a patient profile and medical records. 3.6 Remote monitoring of drug use of pharmaceutical service recipients.
Advantages 1. Expanded access to pharmacy stores in rural locations. 2. Make access to drug administration, monitoring and care for remote patients easier. 3. Cutting down on travel costs for remote patients such as stable chronic patients that have to receive drugs regularly. 4. Reducing congestion in hospital. 5. Reduce costs for hiring staff.
Disadvantages of telepharmacy. 1. Reduce communications between healthcare professionals and patients. 2. Patient health information may be offended through electronic storage or transmission.